Close your mouth now. Choose any note and hold it for 10 seconds. Feel where the vibration goes, not in your throat. Deeper, in the bones of your face, behind your cheeks, above your eyes at the base of your skull. This vibration isn't staying in your larynx. It propagates through your bones at 3,000 meters per second, 9 times faster than sound travels through air. And it's entering a set of cavities carved into your skull that most people don't even know exist. These cavities are resonating, and the gas they produce under resonance changes the diameter of the blood vessels in your lungs in a matter of seconds. You just felt it. Now let's understand what was happening inside the bone. Your skull contains 4 pairs of air-filled chambers, the paranasal sinuses, carved into the bones of your face and forehead. The maxillary sinuses are located behind your cheeks and are the largest pair, the ones you feel vibrating most intensely when you hum. The frontal sinuses are located behind your forehead. They are the vibration you feel above your eyebrows. The ethmoid sinuses are located between your eyes, small, numerous, and delicate. And the sphenoid sinuses are located deep within the skull, behind the ethmoid sinuses. They are the deepest chambers, the ones you feel as a resonance in the center of your head, not on the surface. Each pair is a separate air-filled cavity, lined by ciliated mucous membrane, and connected to the nasal passage by a narrow opening called the ostium. They are not vestigial. They are not drainage passages waiting to become infected. They are resonance chambers, bony cavities with specific volumes, specific geometries, and specific resonance frequencies, determined by the physics of the air column they contain and the dimensions of the ostium that connects them to the airways. The vibration you felt behind your cheeks when you hummed was your maxillary sinuses resonating. The vibration above your eyebrows was your frontal sinuses. The sensation of the sound being inside your head and not in your throat was bone conduction carrying the vibration through the cranial vault at 3 or 4,000 meters per second, 9 to 12 times faster than sound through air, delivering that vibration to each bony cavity simultaneously. When an external vibration approaches the resonant frequency of a cavity, the air inside it oscillates with maximum amplitude. This is acoustic resonance. The same physics that makes a wine glass sing when you run a wet finger along the rim, the same physics that makes a pipe organ produce sound from air flowing through pipes of a specific length. Its sinuses are Helmholtz resonators, chambers with narrow necks that amplify specific frequencies. When you hum, your vocal cords produce a fundamental frequency between 100 and 400 hertz. This vibration propagates through the laryngeal cartilage, the hyoid bone, the mandible, the temporal bone, and the cranial vault. The skull becomes a vibrating shell. The sinuses within it resonate. The oscillating air pressure within the sinuses during singing is measurably greater than during quiet breathing, during speech, or during any other vocal activity. This is because sustained singing maintains a continuous frequency that speech break with its constantly changing frequencies and articulations cannot maintain. Singing is the only vocal activity that sustains a single frequency long enough for the sinus cavities to achieve full resonance. Speech changes frequency with each syllable. Singing changes pitch with each note. Sustained singing maintains a frequency, and the sinuses respond. Not all frequencies produce the same resonance. The maxillary sinuses, the largest pair, resonate at approximately 200 to 350 hertz, depending on individual anatomy. The fundamental frequency of a male singer is generally between 100 and 200 hertz. The female singers is between 200 and 400. Female singing frequencies naturally more closely approximate the resonance of the maxillary sinuses, which may explain why some studies show greater nasal nitric oxide production in female subjects. For maximum resonance coupling, the ideal pitch is a comfortable note in the middle register, not the lowest note you can produce, which might fall below the resonance of the sinuses, and not the highest, which might exceed it. The note that most people naturally produce when humming without thinking about pitch tends to fall within the resonance range of the maxillary sinuses. Whether this is coincidence, anatomical correlation, or unconscious selection by the body for maximum resonance, coupling has not yet been formally studied. You don't need to find the right note. The note that feels most natural, that requires the least effort, that holds with the least tension, that note is probably close to the frequency your sinuses are tuned to. The absence of effort isn't laziness, it's resonance. The body finding the frequency that couples most efficiently with the bony chambers of its own skull. Now let's talk about the gas. Because what the sinuses produce under resonance is the part that connects 60 seconds of singing to the cardiovascular system. And that connection goes through the mucus lining of each sinus cavity in your skull. The sinus epithelium, the mucus lining of each sinus cavity, continuously produces nitric oxide via constitutive nitric oxide synthase. During quiet breathing, this nitric oxide diffuses slowly through the ostia into the nasal airways and is inhaled in small amounts with each breath. Production is constant. Delivery is limited by diffusion. The narrow ostium restricts the rate at which the gas can escape from the sinus into the airway. The sinuses are continuously producing a vasodilator. Most of it slowly accumulates in the cavity because the ostium is too narrow for efficient passive diffusion. This has an important secondary implication. Nitric oxide is antimicrobial. It inhibits bacterial and fungal growth in the sinus cavities. The nitric oxide that accumulates in the sinuses during quiet breathing maintains a baseline antimicrobial environment. Singing, by expelling accumulated nitric oxide and stimulating new production cycles, makes this antimicrobial environment more active. Studies with patients with chronic sinusitis have shown improved sinus ventilation and reduced infection frequency. Acoustic pumping physically ventilates the sinus cavities in addition to delivering the antimicrobial gas. A sinus that is regularly vibrated is a sinus that is regularly ventilated, regularly flushed with antimicrobial gas, and much less prone to developing the stagnant environment in which infection thrives. Researchers at the Karolinska Institute measured nasal nitric oxide production during singing versus quiet breathing and found a 15-fold increase, from approximately 0.2 to 3 parts per million in exhaled nasal air. 15 times, not a percentage increase, not a doubling, a multiplication by 15, an increase of magnitude that would be considered extraordinary for any single intervention. And the mechanism is purely acoustic. The oscillating air pressure during singing dramatically increases the rate of gas exchange between the sinus cavity and the nasal airways. Each pressure oscillation expels nitric oxide-enriched air from the sinus through the ostium and draws fresh air in. The nitric oxide that would accumulate slowly during quiet breathing, diffusing through a narrow opening at the rate physics allows, is pumped out with each vibration cycle and replaced by fresh air that stimulates further production. The sinus is the production chamber. The singing is the pump. The ostium is the valve. The frequency of vibration determines the pumping rate. 15 times is not a pharmacological dose. It's a mechanical amplification. The sinus is producing nitric oxide at its normal rate. Singing is pumping it 15 times faster than quiet breathing can deliver. Consider what happens to this gas after it enters the nasal airways. You inhale it with your next breath. After singing, the nitric oxide-enriched air that was pumped from the sinuses travels down the trachea and into the lungs. At the alveolar membrane, the thin barrier where gas exchange between air and blood occurs, nitric oxide passes into the pulmonary capillary blood. Once in the blood, nitric oxide activates soluble guanylate cyclase in vascular smooth muscle cells, increasing intracellular cyclic GMP, which relaxes the smooth muscle and dilates the pulmonary vasculature. This is the molecular mechanism identical to that of a pharmaceutical vasodilator that generates billions in annual revenue. The molecular pathway is not similar. It is identical. One enzyme, 1 second messenger, one smooth muscle response, one vasodilator result. Indistinguishable at the molecular level, her breasts are manufacturing the molecule. Singing is delivering it to her lungs through the acoustic pumping of bone resonance chambers in her skull. Pulmonary vasodilation has a downstream consequence that you can understand through the physics of gas exchange. Oxygen crosses the alveolar membrane into the blood by diffusion. The rate of diffusion depends on the surface area of the membrane in contact with the blood, the thickness of the membrane, and the partial pressure gradient driving the oxygen. When the pulmonary capillaries dilate, more capillary surface area comes into contact with the alveolar membrane. More surface area means more diffusion area. More diffusion area means more oxygen transfer per breath. The effect is mild. This is not supplemental oxygen. It's not a bronchodilator. It's not a pharmaceutical intervention. It's a modest increase in the efficiency of a gas exchange system that was already functioning. But it is measurable and occurs with each singing cycle. If you've ever noticed that a period of distracted singing while cooking, walking, or sitting quietly left you slightly clearer, slightly more alert, slightly more present, that's not placebo and it's not imagination. It's enhanced oxygen transfer. Your lungs just operated with marginally greater efficiency because your sinuses delivered a vasodilator that singing pumped from bony cavities in your skull. The clarity you attributed to the meditative quality of singing was partly vascular. More oxygen reaching the brain because the pulmonary capillaries were dilated by a gas your own body manufactured. Now let's go deeper into the skull. Because the vibration that resonates in the sinuses and stimulates the vagus nerve is also doing something to the fluids surrounding your brain. And this is the layer that research is only beginning to map. When you hum, your vocal cords vibrate the laryngeal cartilage, which transmits the vibration through the hyoid bone, the mandible, the temporal bone, and throughout the cranial vault. This is bone conduction, mechanical vibration propagating through solid structures at 3,000 or 4,000 meters per second, much faster than through air. Your skull becomes a vibrating shell, and every structure within it receives the vibration through the bone. Your inner ear detects bone-conducted vibration via the cochlea. This is why you hear your own singing as louder and deeper than anyone else hears it. Bone conduction delivers low-frequency vibration directly to the cochlea, bypassing the air conduction pathway, which attenuates low frequencies. Bone conduction means that the vibration reaches the vagus nerve not only through the tissue surrounding the larynx, but also through the temporal bone adjacent to the nerve's intracranial course. The vagus receives the vibration from two directions simultaneously, locally in the larynx and remotely through the skull. This dual delivery is unique to singing. External sounds do not produce it. Speech does not sustain it. Melodic singing interrupts it. Only sustained singing delivers continuous bone-conducted vibration to the vagus via both pathways for the entire duration of the note. Consider what this means for the nerve. The vagus nerve passes directly alongside the larynx, separated from the vibrating vocal cords by millimeters of tissue. During singing, the sustained vibration of the vocal cords mechanically stimulates the vagus nerve through the surrounding tissue. Not through a neural pathway, not through a reflex arc, but through direct mechanical vibration of the nerve itself. If you were wearing a heart rate monitor while humming, you would see the effect in 15 to 20 seconds. The heart rate drops, typically 2 to 5 beats per minute, and heart rate variability increases. Vagal activation is shifting the autonomic balance toward parasympathetic dominance. You would feel a subtle settling, a sensation of your chest opening, your shoulders dropping slightly, your jaw releasing tension you didn't even know you were holding. The sensation comes effortlessly because the mechanism requires no effort. The vibration stimulates the nerve. The nerve responds, the heart races. No conscious regulation is needed. This is a third pathway for vagal activation, distinct from the baroreflex receptor feedback produced by slow breathing, distinct from the trigeminal vagal reflex triggered by cold water on the face. Singing stimulates the vagus nerve through direct mechanical contact at the anatomical location where the nerve is most superficial and most exposed to laryngeal vibration. Now let's look at the breathing mechanism. Because singing can only occur during exhalation, this physical restriction produces a breathing rate that clinical protocols take weeks to teach patients to achieve. Singing is exhalation. Inhalation is necessarily silent. You can't hum while breathing. The vocal cords require exhaled air flowing through them to vibrate. Inhaled air flows in the wrong direction. A natural singing cycle, therefore, produces an exhalation to inhalation ratio of approximately 3 to 1 or 4 to 1. Singing extends exhalation to 8 to 12 seconds, while inhalation remains for 2 to 3 seconds. This ratio is the interval that maximally shifts the autonomic balance toward parasympathetic dominance. You don't need to count. You don't need to follow a pattern. The vocal cords dictate the proportion. Singing extends the exhalation because singing is exhalation. Inhalation is brief because it's a pause between chants. The body takes what it needs and returns to the note. Extended exhalation activates the vagus nerve via a secondary pathway, the baroreceptor reflex. Your aortic arch and carotid sinus detect the slight increase in blood pressure during extended exhalation and trigger vagal output to slow the heart rate. This is the mechanism behind every clinical breathing protocol: box breathing, 4-7-8 breathing, coherence breathing. They are all attempting to achieve the exhalation-dominated ratio that singing automatically produces as a physical consequence of how the vocal cords function. Protocols require training. They require counting. They require sustained attention to maintain the ratio. They require weeks of practice before the pattern becomes habitual. Singing requires nothing more than a closed mouth and a note. A person who sings for 60 seconds is performing, without instruction, without counting, without training, the breathing pattern that the clinical literature identifies as ideal for parasympathetic activation. Now, two vagal pathways are operating simultaneously. Direct mechanical vibration of the nerve and baroreceptor-mediated exhalation activation produce a combined parasympathetic shift that neither pathway produces alone. The person singing for 60 seconds is receiving vagal stimulation through two independent mechanisms running in parallel. Heart rate decreases. Heart rate variability increases. The autonomic nervous system shifts from sympathetic to parasympathetic dominance, not because the person decided to relax, but because the physics of a vibrating vocal cord and a closed mouth produce the neural and respiratory inputs that the autonomic system interprets as safety. During singing, the closed glottis and sustained exhalation produce a slight increase in intrathoracic pressure. The pressure inside the thoracic cavity increases because air is being pushed against a partially closed valve. This pressure increase is transmitted through the venous system to the intracranial space. A direct hydraulic connection is made via the internal jugular veins and dural venous sinuses. The veins connecting your chest to your skull are open tubes. Pressure changes in the chest propagate to pressure changes in the skull in a cardiac cycle. The result is a smooth rhythmic oscillation of intracranial pressure synchronized with the frequency of singing. Cerebrospinal fluid, the fluid that surrounds and cushions the brain, that fills the ventricles, that circulates through the subarachnoid space, oscillates in response to these pressure changes. The fluid is not static. It moves with each heartbeat, with each breath, with each change in intrathoracic pressure. Singing amplifies the respiratory pressure component through the added airway resistance of the closed glottis, producing larger and more rhythmic cerebrospinal fluid oscillations than quiet breathing generates. The glymphatic system, the brain's waste disposal pathway, depends on the movement of cerebrospinal fluid through the brain's perivascular spaces. Cerebrospinal fluid flows through perivascular channels, collecting metabolic waste including beta amyloid, and draining through perivenular pathways. Any intervention that increases the pulsatility of the cerebrospinal fluid, that moves the fluid more actively through these channels, potentially improves the elimination of metabolic waste. Singing, by promoting rhythmic oscillations of intracranial pressure, may contribute to this pulsatility. Now, the calibration of the evidence. Because the 5 mechanisms described here are at different levels of certainty, and honesty demands transparency about which shelf each one occupies. The data on nitric oxide are solid. The 15-fold increase is replicated. The mechanism is understood at the molecular level. Vagal data are established. Mechanical nerve vibration is documented. Autonomic change is measurable in real time. The breathing ratio is physical. The exhalation to inhalation ratio is a consequence of vocal cord mechanics, not a hypothesis to be tested. The oscillation of cerebrospinal fluid is the most preliminary layer. Changes in intracranial pressure resulting from respiratory mechanics are documented. That singing amplifies these changes through glottal resistance is physically consistent. That the amplified pulsatility of cerebrospinal fluid improves glymphatic clearance during 60 seconds of singing has not yet been directly measured. Physics supports the connection. Direct evidence does not yet exist. The viewer needs to know which shelf each mechanism belongs to, and the cerebrospinal fluid mechanism is on a different shelf than the nitric oxide data. 5 mechanisms operating simultaneously from a single closed-mouth vibration, each at a different level of evidence. The strongest have been replicated and measured. The most speculative are supported by physics but not yet confirmed. The mechanisms confirmed in isolation, nitric oxide production in the sinuses, vagal stimulation, and the ratio of respiration dominated by exhalation would already justify the 60 seconds. The preliminary mechanisms may eventually extend the justification even further. Physics supports all 5. Evidence confirms 3. The viewer must keep that distinction. What you felt when you hummed at the beginning of this explanation, the vibration in your face, the resonance behind your cheeks and forehead, the sensation of something moving in your skull, was the activation of bone resonance chambers pumping a vasodilator into your airways. The mechanical stimulation of a cranial nerve running alongside your vocal cords. A breathing ratio dominated by exhalation that your own vocal cords impose without instruction. And a gentle oscillation of the fluids surrounding your brain, driven by the pressure mechanics of a closed glottis. 4 confirmed mechanisms running simultaneously. 1 speculative mechanism consistent with physics. The pharmaceutical industry has spent billions developing inhaled nitric oxide delivery systems for pulmonary vasodilation. Systems that require compressed gas cylinders, precision flow regulators, specialized delivery masks, continuous monitoring equipment, and hospital settings with trained respiratory therapists. Your skull already contains the delivery system. 4 pairs of production chambers connected to the airways by narrow ostia, continuously producing the molecule, awaiting their acoustic pump that releases it into the lungs. The pump is the corner. The delivery system is the sinus architecture you were born with. The molecule is what the hospital charges thousands of dollars per treatment to deliver through industrial equipment. 60 seconds of corner delivery to your kitchen table, not in pharmaceutical concentrations. The dose of cannula is mild. The vasodilatory effect is modest, and no one is suggesting that cannula replaces medical nitric oxide therapy for critical conditions that require it. The pharmaceutical application exists for a reason. Neonatal pulmonary hypertension, acute respiratory distress syndrome, conditions where the dose must be precise and delivery must be continuous. Cannula is not that. Cannula is the daily, low-dose, accessible version of a molecular pathway the body possesses. The mechanism is identical. The dose is different. The accessibility is unparalleled. The pharmaceutical version requires a hospital. The biological version requires keeping your mouth shut. 4 pairs of air-filled chambers carved into the bone of your face, a gas produced within them that relaxes the blood vessels in your lungs with each singing cycle. A nerve that vibrates when your vocal cords vibrate and cannot stop responding to the mechanical stimulus it receives. A breathing rate that clinical protocols take weeks to train and that a closed mouth produces on the first try. And a fluid that surrounds your brain, oscillating when your skull vibrates gently and rhythmically at the frequency of the note you have chosen. You felt all of this at the beginning of this explanation in the 10 seconds you hummed before the explanation began. The vibration in your face was sinus resonance. The feeling of calm coming on was double vagal activation. The prolonged exhalation was autonomic rebalancing. The grounding may have been vestibular input from bone conduction. The mechanisms were working before you knew their names. They will work again tonight if you hum before bed. Close your mouth. Choose a note, 60 seconds. Your skull does the rest. 0.